Welcome everybody to our webinar. It is a perfect time to talk about feeding your young growing horses. I know end of the year we talked about feeding brood mares and what was new in feeding brood mares. Um, and now I think it's really important to start talking about feeding those young growing foals because the foaling season has certainly started for a lot of folks. Um, and we want to make sure that we're getting those babies off to the right start. And if there are any issues that crop up, that we can help our clients with those issues. So we know that the nutrient requirements for foals really does start in utero. You hear me talk all the time about you building the foundation when the foal is still in utero in the mare, and once the foal is born, then that's what we call postnatal nutrition. We're going to focus more on postnatal nutrition, but um, know that in utero that is absolutely critical. So you've got to feed the mares um, during pregnancy. That is going to have the most flexibility, the most influence over the outcome of your foal. Talk about the role of nutrition in certain disorders and some ideal diets. So we're really feeding future equine athletes. And horses' skeleton grows really quickly. They have to get up quickly and be able to run away from predators. So the skeleton has to be strong. If you think about other animals that are not, they maybe stay in a pouch or they're in a nest, or they don't have to be as developed as quickly as foals do. So foals really have to have rapid skeletal growth. They have a lot of skeleton development already in utero, skeleton and cartilage, and we know that minerals are deposited in that bone. And we know that if they don't get enough minerals, then we have really poor conversion of that cartilage to bone. And that's really it's that conversion from cartilage to bone where we see a lot of breakdown. So we need to make sure that the cartilage is healthy, and then as it converts to bone or ossifies, that process can happen without any problems. We know that before even thinking about feeding a foal, we have to get the mare pregnant. And like I said, we've touched on this in other presentations, but really quickly, we know that certain minerals are important for implantation. So for that embryo to implant into the uterine lining, we've got calcium, iron, copper, zinc, cobalt, iodine, manganese, and selenium, vitamin A, E, and then a whole slew of B vitamins that are all critical early in that mare, just to make sure she's reproductively active so that she can actually get in foal, and then that we can have implantation of that little embryo so that then it can develop. So after implantation, that first 30 days, we're looking at calcium, copper, zinc, selenium, zinc, selenium, iodine, cobalt, iron, and cadmium. Some of these are very prolific in the forage. So if you're feeding plenty of forage to your horses, then those nutrients will be met. But things like calcium, copper, zinc, selenium, we need to be supplying those in the horse's diet. In utero, we'll just briefly go through this. We know that, we're looking at these graphics here at day 9, day 24, and day 30, and by day 40, I should say, there is a very defined shape of an animal there, and we already have the heart is developed at day 24, and we can see heartbeat. And in order for those um, critical organs to develop properly, we know that there are certain minerals that are very very important. So zinc, copper, vitamins A and D are really critical for heart development. We know that early embryonic loss in that first 30 days is a big deal, and we try not to change much. We don't want to change the feed. So it's not like we're going to have her on a certain feed and then she's going to get pregnant and then we're immediately going to change her feed. We want to keep her on that same feed for at least those first 30 days to avoid any kind of nutritional stress on the horse. We try not to change their environment drastically during that early pregnancy phase. In mid-gestation, we're looking at that 7th, 8th month. We know that energy and protein are increasing. We get about 90 grams a day of fetal growth, but we also know that vitamins and minerals still really critical. Liver, heart, kidney, brain, lung, bone. It doesn't matter whether it's a dressage horse, a barrel racing horse, a horse that's going to end up being a backyard pleasure horse or a Kentucky Derby winner. They all need to have these organs in order to survive. And to be a healthy, strong, profitable animal for you. So you see iron across the board, absolutely critical. Selenium, copper, zinc, and your vitamins. When we see B12, choline, folic acid, B6, these are all biotin. These are all B vitamins. And horses are very rarely deficient in B vitamins if they have plenty of forage. Why is that? What's the connection between forage and B vitamins? The bacteria that live in the hindgut of the horse create B vitamins. So, in order to give your horse plenty of B vitamins, you don't go out and buy a supplement that's going to put B vitamins in the horse. You make sure that they're getting plenty of forage in the diet and you're feeding a supplement that's going to enable them to break down that forage that's going to give them B vitamins, right? In late gestation, the 9th, 10th, and 11th month, we really just are laying down a lot of tissue and fat. We've got 80% of the actual body weight will be laid down, half a kilo, so that's a pound of gain per day. But the big thing when it comes to vitamins and minerals is we're fortifying fetal liver stores. So what that means is the mare's milk is really low in minerals. And so for the first 3 months, when the foal is heavily reliant on the mare's milk for protein and energy, and they're just drinking milk and maybe nibbling a little bit at their mother's food, they're not getting minerals out of the milk. So where are the minerals coming from? Because they're not fully eating grass or grain at that point. They're pulling them out of their own liver stores, copper, zinc. And that mare actually needs to consume enough for her own maintenance as well as putting those nutrients into the fetal liver in late gestation. So that's why you'll see mineral requirements also increase in late gestation. It's not necessarily because the foal is getting bigger, it's that we're fortifying that fetal liver. So when I ask in presentations, when's the most important time to feed your foal? Is it once it's born? Is it first trimester, second trimester, third trimester? Is it before she ever goes to the breeding season, breeding shed? All of those are true. Every single one of those phases is the most important time to feed your mare. Don't think, oh, well, she's fat and shiny and she's otherwise healthy, so I don't need to feed her anything in the first trimester. You may not need to feed her extra protein and calories, but 100% she needs to be on a vitamin and mineral supplement. Mid-gestation, late gestation, it's still absolutely critical, even before she goes to the breeding shed, that she's on a good vitamin and mineral supplement. I was having this conversation with Everett the other day about DAC Orange versus the Breeder's Choice Plus, and both work very, very well. The Breeder's Choice Plus has a little extra selenium and vitamin A, so that's going to help with reproductive efficiency for those mares. But if your mares get pregnant fine and you feed everything else in the barn, or your client does, the DAC Orange, then the DAC Orange will be fine for your brood mares. It's not only about choosing the correct supplement for the horse, it's also about choosing the correct supplement that's going to fit within the management structure of your client. Is buying Breeder's Choice Plus, they've got one brood mare and it's going to take them, 5 years to get through that bag, then just keep them on the DAC Orange. But if they have a difficulty, number one, if it's a maiden mare and she's never had a foal before, if she's an older mare, or anytime she's had difficulties getting pregnant, then definitely that horse should be on Breeder's Choice Plus because of the additional vitamin A and selenium. But any other time, if DAC Orange or Total Performance is in the barn and that's what they feed the other horses, then that will work too. So you can see here that fetal growth is it's not linear, right? You can fall into the trap of thinking for those first 5 months that the horse should just need a maintenance diet, doesn't really need a lot of extra nutrients because we're not laying down tissue and fat. But then you can see from the fifth month to the 11th month, it's kind of exponential in growth rate, and really ninth, 10th, and 11th when we get most of the actual body weight is laid down on that foal. But when the foal is in those first 5 months of pregnancy, it's not huge, so the nutrient requirements aren't significantly increased, but they're absolutely critical. So at 7 months of pregnancy, we've got about 20% of the birth weight, but by the last 3 months of pregnancy, we talked about the trace minerals for the fetal liver storage: copper, manganese, iron, and zinc. So in utero, if we don't feed our horses enough calcium, then we certainly can see a reduced body weight and potentially decreased bone mineralization. If our foals aren't getting enough vitamin A during pregnancy, it will also decrease fetal weight and health status, reduced organ weight. Now, you think, okay, well, what does reduced organ weight really mean? Okay, let's say we're breeding thoroughbreds and we want them to be racehorses or standard breds, or even we're breeding quarter horses to be barrel racing horses. They need a huge heart to pump as much blood around their body as they can, so that they can move quickly. They need big lungs. And if we have reduced organ weight, then we're setting that foal up negatively from the very beginning. Lowered elastic fibers. Well, how's that going to affect my horse? Elastic fibers are in all of the joints, in the tendons, in the fetlock and pastern. You've got such flexion. If you've ever watched the slow-mo videos of horses galloping, it's just absolutely amazing the amount of flexion in the fetlock and pastern in these horses. Delayed lung maturation, and that also plays into any horse that is kind of going to grow up to do anything at speed. Mares at pasture pretty rarely have vitamin A deficiency, but more and more of our horses are stabled. And hay, just like vitamin E, is deficient in our hays because the oxygen and the light, once you cut the hay, kind of oxidize that vitamin E. It does the same with vitamin A. So if you do have horses that are stabled, or brood mares that are stabled a lot, then you definitely want to increase the vitamin A by doing something like the Breeder's Choice Plus. Copper stored in the fetal liver. You can see here copper in the fetal liver, and it's increasing in the fetal liver, and then once it's born through 5 months of age, it just significantly plummets. So by 3 to 5 months of age, your foal is really consuming their own ration. So that ration then is supplying them with their copper requirements. But we definitely know that copper deficiency can cause bone problems in foals. A lot of people focus on protein and think, oh my God, I can't give my horse too much protein. It's going to cause these joint and bone abnormalities. And that's just an old wives' tale. I don't even like to call it a wives' tale because I always joke and say women couldn't have come up with this stuff. But protein is absolutely critical in your young growing babies. I ask the audience, anyone who's had a child knows that if your child had a wonky leg, there's no way you're going to limit its protein intake thinking it was going to correct its leg. It's just not true, and it's not true in horses either. Protein doesn't cause any problems. I will tell you that if you don't feed your horse enough good quality protein, then you will 100% cause issues, negative issues. Iodine, the reason why I don't like supplements that contain iodine, and iodine, if you look in the ingredients list, will come from things like seaweed. Now, this isn't the sea, like the ocean-derived calcium, the calcite, or the sea-derived calcium. This is seaweed. It is very high in iodine, and it can be all over the shop, and that can really have a negative effect on the mare. And also that foal will not a lot of things can detrimentally affect the foal if the mare absorbs too much of them, but iodine definitely will pass across the placental barrier. Major growth periods for bone, 3 months before until 9 months after birth, we have significant bone development. And muscle, we're seeing from 2 to 22 months of age, significant muscle development as well. So you've heard me talk about protein and quality protein. I talk about quality protein all the time, and what does that mean? And you've probably heard the term essential when we're talking about amino acids or fatty acids. What that means is the horse can't make it in its body. So B vitamins, for example, I told you that the microbes in the horse's hindgut make B vitamins. So B vitamins are not considered essential because the horse can actually manufacture them in their own body. Essential means that it's not manufactured by the body or any microbes living in the body, but they must be consumed in the diet. Amino acids like lysine are considered essential. They must be consumed in the diet. We also talk about lysine as the first limiting amino acid. It's the most important amino acid because the amount of lysine in your horse's diet dictates the use of every other amino acid. So let's say the requirement for, and I'm making this number up just so that it's easy for you to visualize. Let's say the requirement for lysine is 10 grams, 10 grams a day, but you only have 5 grams in the diet. But we have 100%, 120, 130% of all of the other amino acids, the leucine, methionine, threonine, tryptophan, 130% of all of those are met in the diet. So they're more abundant, and there's so much of them. All of the other amino acids are being met in the diet, but they can't be used because if you've only got 50% of the amount of lysine, it means you can only use 50% of all the rest of those those amino acids. So the amount of lysine in the diet really dictates the amount of the rest of the amino acids you can use. And we often use this barrel example, that every slat in the barrel, in the wooden barrel, represents an amino acid, and how much water can you put in that barrel? You can only put it up to the lowest slat. And so if your lysine is deficient, then all others will only be utilized up to that point. The kind of gold standard for the requirements for young growing horses is set by the National Research Council. It's back in 2007, so it's not that new. And Dr. Duran and myself have adjusted values that we have for the requirements for growing horses and adult horses, just because we know that this information is a little outdated. But we've got here, 4, 6, 12, and 18 months, and the average body weight of these horses. This is assuming 1,000, 1,100 pound mature body weight. So at 4 months of age, these horses are going to run anywhere around the 370 pounds. By weanlings, we've got about 480 pounds. Yearlings about the 700 pound mark. And you can see that the mare's milk production at 4 months of age is kind of at its peak at 3 to, well, really, it's starting to drop off at that point. So from 6, 12, and 18 months of age, the milk production is really significantly decreasing. Energy requirements do increase because the foal is gaining significant amount of weight, and as is protein, quality of protein, lysine plus calcium and phosphorus. These are absolutely critical in those young growing foals. When to begin feeding? I get asked this a lot. When should I start feeding my foal? And if we just look at the lactation curve, and we think that the lactation curve in the first 3 months that's when they're producing the most milk, and that's when the most energy is provided by milk, then you can see that it starts to decrease. So right at the peak of the lactation curve, that's really when you want to start introducing the foal to feed. So I usually say about 3 months of age, you want to increase you want to make sure your foal is eating their own ration. If you know that your foal has some joint issues, is a big foal, the mare's got a lot of milk, they're growing quickly, then I say supplement them as early as 30 days of age with a vitamin and mineral supplement. The other thing, whenever you want to wean them, some wean early, some wean late. Weaning is very stressful, so you need to make sure that whatever you're going to feed them post weaning, that you've got them adapted to that feed prior to weaning. You know, some mares don't produce a lot of milk, so we're looking at creep feeding those foals, and this is also a way to encourage them to eat their own ration without the mare getting it. There's all kinds of kind of contraptions that you can make. Oops. And if we're doing, say, a ration balancer type to get some extra protein, or you're using a mare and foal feed, then the amounts of feed are about 0.5 to 1 pound of feed per body weight, 100-pound of body weight. If we're going to go down the route of just colt grower or DAC orange, then you're going to want to use, now, depending on the type of horse that you're feeding, if we're worried about joint issues or growing too quickly, then you would use maybe beet pulp alfalfa base to put it on. If we've got a horse that needs a little weight gain, then we can use some oats in that. But the critical element that we're not going to get out of just a straight vitamin supplement is the protein. So these young growing foals need to be fed an additional protein source. And oftentimes I just say feed the horses alfalfa hay or alfalfa pellets, and that's going to get them their protein. All of these minerals, I love like looking at it holistically like this. You can see we're not ever just talking about one thing. We're not just talking about fetal development or coat condition or milk production. We're talking about all of zinc and copper, selenium, manganese are pretty much important for every one of the kind of pathways on this graphic here. And something like the CMZ paste, copper, manganese, and zinc. That's all it is. So when you're looking at trying to improve the quality of protein in the diet, in particular lysine, dietary, it's gonna 100% come from alfalfa. That's just the easiest way to do it, because that's also the largest quantity that the horse is going to eat is hay. They eat, at that age, they're eating half an ounce to an ounce of supplement, which is going to be perfect for the vitamins and minerals, but it's certainly not going to give them the protein that they need. So we're going to look at alfalfa for their lysine requirements. We look at those disorders. So developmental orthopedic disease is kind of the umbrella term that we use that encompasses all of these diseases. So developmental orthopedic disease isn't a thing on its own. You can't say my horse has developmental orthopedic disease. Well, that's kind of a way of saying I have sore muscles, but what caused my sore muscles? And so all of these different disorders, osteochondrosis, fasciitis, wobbly limbs, flexural deformities, spinal cord deformities, these all fall under the category of developmental orthopedic disease. And it's probably one of the biggest fears we have as breeders of horses is that they might develop a joint issue. It's the number one reason for failure of racehorses is these kind of DOD, these joint issues in youngsters. We know, so something that I've been investigating more and learning more about is that we know that the joints ossify or cartilage turns into bone. They develop, for lack of a better word, from the ground up. So the fetlock is going to be fully developed and mature before the knee, and the knee before the elbow, and the elbow before the shoulder. So the higher up the leg, the longer it takes for that to develop. All right. We know that our OCD type disorders, so in the joint, that cartilage, really when we have that failure of cartilage to turn into bone, anywhere from 3 to 20 months of age, we're going to see that. Fasciitis is just inflammation in one of those joints. Itis just is inflammation. Angular limb deformities, wobbly deformities in the very, very early 1 to 6 months, we're going to see that. And then vertebral abnormalities, you can see a bit later on, 6 to 9 months of age. At birth, horses will only have about 17% of their mature bone mineral content. So minerals are extremely important in the right balance once that foal is born. At 60 days of age, the horse should have grown by at least 75% of the mature wither. Most lower limb growth, as I said, is complete before the yearling phase. By 18 months of age, the most 1,000, 1,100-pound horses will have achieved their kind of mature height. That's not to say they're fully developed. It's just that they're probably not going to grow much taller. If we look at the stages of bone growth, I think it's really neat to understand how the bone develops, so that then you can understand kind of how those problems arise. So in the fetus, we've got blue as cartilage. So in all these graphics, blue is going to be cartilage. And so we've got something that looks like a bone, but it's a shape of a bone, but it's all cartilage. And then in the very middle, we get these things called osteoblasts, and they are bone cells, for lack of a better word, and they are going to proliferate, and they're going to start in the middle and work their way out. And so now we've got more bone developed, spongy bone, in the middle of that limb. That's all going to be in the fetal stage. As once we get into that late fetal stage, last trimester, into once they're born, then we're going to see it, the osteoblast, that bone formation kind of stops before we get to the very ends of the bone. And then it starts again in the middle of the end of the bone, and it starts to fill out. And by the time we have a foal, we now see we've just got one thin line of the light blue. That's the growth plate. And now we've got different cartilage. Cartilage is still blue, but on the end, it's a different color blue, because that now is what we call hyaline cartilage, and that's the cartilage between actual joints. So now it's got shock absorbing capacity, and we've got things like hyaluronic acid and other proteoglycans in as the joint fluid between those two bones. And back right in the middle now, where the osteoblast, those bone cells, started to develop, now we've got a marrow cavity developing. And when we have a full-grown adult horse, we have the marrow has filled out that middle section. We don't have the growth plate anymore. That's ossified over. It's been converted into bone, and that growth plate is where we see all these growth problems. And then we have this hyaline cartilage on the end, fully developed. So growth plate conversion, as I said, from the bottom up, we're going to see it develop earlier down in the bottom. So short pastern, down in the pastern, before birth to between 9 and 12 months. The longer pastern, we're going to see those growth plates fully closed between 13 and 15 months. The cannon bone, where the top unites, it's not going to finish until about 18 months. In the knee, we're looking at 18 months to 2 years of age. As we get up into the shoulder of the horse, though, which is going to, if you think about doing sharp turns to the right or left, or you look at these barrel racing horses that lean in to those shoulder joints and up into the humerus and scapula, we're looking at 3 to 3.5 years of age before those are fully closed over. We don't think about it because we don't see those growth plates because they're right in the tissue, but we can see the fetlock, we can see the knee, we talk about the open knees and that growth plate fully closing. We can't see it in the shoulder, but know that the shoulders are not fully weight bearing and developed until 3 to 3.5 years of age. So you think about the torque that's going, sideways torque in these types of young horse activities, quarter horses, barrel racing, cutting, reining, and that sideways activity that's going on. That's what I say. We're not going to take away these young horse classes, and we're not going to stop racing young horses, but it's our job as breeders and as folks that help people breeding horses to make sure that those foals have the best chance of success. They're going to be as strong as they possibly can. We're going to feed them all the right minerals, and we're going to set them up as best we possibly can. So we know that there are a lot of things that go into whether a horse is going to develop any of these growth issues: genetics, injury, stress, disease. But nutrition is the thing that we can control the most, besides genetics, of course. If you know that a certain stallion throws these joint issues, or you've got a mare that every baby seems to have joint issues, then you just take them out of your breeding program. There's nothing else that can be done for that. But nutritionally, we know that overfeeding, underfeeding, certain minerals can be toxic. So we want to make sure that we can control that best we can. Why it's so important is these nutrition mistakes, especially in utero, can just be amplified. Um, and they will result in reduced performance potential. When we look at what areas we want to focus on, energy, which is calories. We don't want these horses fat. We obviously don't want them thin either, but we certainly don't want them fat, carrying a lot of extra weight. And people talk about, slowing the growth down. You're not really slowing the growth down per se, but you're not having them have a lot of extra calories, that they're growing faster than they should be, and carrying a lot of extra weight. So the minerals, calcium, phosphorus, absolutely critical. Copper and manganese, absolutely critical. There's lots of research looking at energy in the diet, and excess or a lot of energy in the diet will cause them to grow a little faster. It puts more stress and trauma on the bone, because what happens if we give them excess energy and you don't support the excess growth with additional protein and vitamins and minerals, that's where we see abnormalities. Now, there's a limit. I could take a horse that's going to go to a yearling sale or a weanling sale, and we can push them and get them to mature, looking more mature, younger. But it really does take finessing the diet, because you're adding a lot of extra calories to the diet, but you're also having to make sure that you're backing that up with good quality protein, good quality vitamins and minerals, and adequate amounts that they can absorb in adequate forms that they can also absorb. Glucose and insulin. I'm always more inclined to go with a lower sugar starch diet than feeding young foals a lot of sugars and starches. I'm not inclined to feed young foals a lot of corn or barley. Oats is one thing, but I try to steer away from the sweet feed type products for young growing horses, because it can interfere with glucose and insulin, and we know that those do interfere with insulin-like growth factor and growth hormone, both very important hormones in bone and cartilage development. We've mentioned these issues with excess body weight. If they're too heavy, that's just putting a lot of extra stress on the youngster, and then steering away from those high sugar starch type diets because it's interfering with those hormones. But as I mentioned, just because a diet is high in digestible energy, it does not guarantee that they will have a growth problem if you're also supporting that extra growth with adequate vitamins, minerals, and protein. So it's kind of like energy in the diet. Everything needs to be proportional to the energy. Excess protein is often implicated, and I shouldn't say implicated. People just have this myth in their head that excess protein is going to be a bad thing for their foal, and it's just if you don't learn anything else tonight, know that protein is not the devil. It is not what causes horses to have growth issues. Okay, there's no research to support that whatsoever. It doesn't make adding a lot of extra protein to the diet won't make them grow faster, but not adding enough protein to the diet will increase your risk for joint problems. It's certainly not going to be beneficial to them. It will impair growth and could lead to these growth issues. It's a really important component of bone and cartilage development. Excess calcium is not generally a problem, but high calcium can decrease the intake of zinc and manganese and iron in other species. Haven't seen it as much in horses. We really don't see a lot of high calcium intake, but ideally our ratios are ideally calcium to phosphorus a 2-to-1 ratio. Maximum ratio would be 5-to-1. And you're not going to see a lot of that unless you're feeding 100% alfalfa as well as other feeds and supplements that are very high in calcium. One thing that I've done with kind of an off-label use of a product, the DAC pre-buff, which is just the marine-derived calcium, which is very, very available to buffering stomach acid in horses, but also for uptake for bone development, is used. So the feeding rate for the pre-buff is, I think it's 30 cc's a day. But in these young foals, I might use 10 cc's a day if we've got a problem. We're going to use the CMZ paste, but we want to use a little extra calcium as well in a really available form, then I will use the pre-buff. Calcium and phosphorus go together, and deficiencies in either or both can cause developmental orthopedic disease. But as I mentioned, high calcium is not very common in horses, but we do know that we never, ever, ever want this ratio to be inverted. If you have more phosphorus than calcium, then that will also impede the uptake of calcium, and they'll start sucking it out of their own bones, and that's going to be very detrimental. So you never want to have more phosphorus than calcium. Copper deficiencies can cause developmental problems because copper is really important in the cartilage matrix and cartilage to bone formation. So a lot of research done in New Zealand on these pasture-based animals looking at the role of copper supplementation, and certainly foals that were from mares that were deficient in copper had a lot more articular lesions, OCDs. So that articular cartilage had abnormalities in it, and when you have an abnormality, then it doesn't ossify into bone, and then we have a pocket, and then we have an OCD, or that cartilage might break off and float around in the joint, and then we have real problems. So we know that copper deficiency can cause that. We also know that zinc deficiencies can cause these issues, and zinc and copper kind of go together like calcium and phosphorus go together. If we have excess zinc, and this isn't just talking about excess zinc, but where we get excess minerals a lot is also in minerals that are not absorbed well, so they just float around in the blood and cause issues. So we use chelated minerals. We use proteinuates and amino acids attached to these minerals to make them more bioavailable. So they're absorbed into the bloodstream and they go into the different tissues where they're going to be actively used. But if we use these rock type or inorganic minerals, then they can build up in the system and not get used and can cause issues. So we know if we have excess zinc that isn't being absorbed properly, then that can actually cause decrease in calcium and copper absorption. This was it's a bit older research now, but standardbred foals, and where in a feeding program where the mares were not eating a fortified diet. What does fortified diet mean? It means that they were not. A fortified diet is one that has the vitamins and minerals in it. So these guys did not have vitamins and minerals. 50% had OCD lesions, and 28% of them had them in more than one joint. So even if you think, oh, well, they're easy to correct, I can just do surgery. Now you're looking at doing surgery on 30% of them in more than one joint, and that becomes expensive and really detrimental. So, as I mentioned, more mineral isn't always better, but we also, not only do we have to look at how much mineral or the lack thereof, but the quality or the types of minerals that we're using. Are we using chelated minerals? Are they available? Is there competition for those minerals? Or are we attaching something to those minerals to make them absorbable? And we use chelated minerals, which means we're attaching them to an organic substance that is very bioavailable. So we're not seeing excess minerals be excreted into the manure, and it's not just floating around in the blood, not being able to be absorbed. So what you're paying for is actually being used in the horse. So really what we do is we take that rock type mineral, because all minerals are natural. So this is another question that I get asked often. Do we use natural ingredients? And rocks are natural. It doesn't mean I need it. Doesn't mean I want to eat a rock. And so inorganic trace minerals or rock type minerals are natural. They're just not very available because horses shouldn't eat rocks. What we do is we take another organic substance that horses are meant to eat, so amino acids, proteins, and we attach them to that inorganic rock type mineral, and now we make it much more bioavailable to the horse. In both forms, it's natural, but one form is just much more available to the horse. So if we look at some kind of timelines and what might be possible causes other than, we know that trauma and genetics and conformation can all play a role, but nutrition, age when you might see the issue. So if we're looking at it and we see at under 8 weeks of age, so we're in the first couple of months of age, and we're seeing some joint issues, well, this is going to mean definitely mares mineral intake was low during pregnancy, or it could be an older mare or a mare with placentitis, which means that placenta isn't very effective at absorbing those minerals and passing them through, and so that fetal liver wasn't able to be fortified. And under 4 months of age, maybe it was the mare's just producing a lot of extra milk and above average growth rates. When we're looking at that weanling to yearling age group, we're looking at the ration not being balanced, potentially too heavy, a lot of extra calories that are not being supplemented with enough protein and minerals to go with it. So what do we do? Depending on the age, I will encourage people to wean their foals early. So if you've got a 3-4 month old foal and you're seeing these issues, then I recommend you wean them. Anything from 3 months onwards, I recommend to wean them, because then you're 100% controlling what's going into their mouth. We're not relying on what is or is not coming out of the mare's milk, and how much are they nursing, and how many calories are they getting. We're controlling all of it. We do want to reduce the calorie content. Yeah, and I have slow the growth here. It's not really slowing the growth. It's just not allowing excess rapid growth, and also not allowing these kind of rapid swings in growth, and analyzing the diet to make sure we're getting all of the correct vitamins and minerals, using supplements like the CMZ paste, the pre-buff off-label, the cult grower, um, but also things like the DDA, because they are eating hay, they are eating grass, and we know that our healthy hindgut, healthy bugs in the hindgut are going to feed back to the brain and influence hormonal patterns, but also create things like B vitamins and unlock more nutrients out of the hay. Depending on the severity, is it just a little inflammation that they can work their way through, or do we have heat in the joint? Sometimes we recommend stall rest to prevent more damage, and obviously the minerals, oops, oh shoot, the minerals that we've talked about. Controlling growth rate, amount of hay or grain, yep, adequate mineral fortification, exercise. Sometimes we're going to use some anti-inflammatories. Maybe we try a little yucca to help with any inflammation. So if we have a horse like this, then, we want to 80% of their normal energy intake. So we're going to decrease their calorie content. We're going to maintain protein, vitamins, and minerals. Common mistake is to take all the grain away, and we're going to starve it out of them, because you're never going to do that. And when you do that, you really just make the problem worse, because in doing that, you're taking away their only source of vitamins and minerals, when we, in the stereotypical sense, take away all of the grain. So if you're going to take away all of the cereal grain, corn, oats, barley, then that's fine. But you need to make sure that you continue to use hay pellets or beet pulp or whatever to give the horse the vitamins, minerals, and protein that they need. Here's a diet where we've limited energy intake, but we've got some grass hay, we've got some alfalfa, and we've got that cult grower, and we have balanced the diet. So as much grass hay as they wanted, a couple of pounds of alfalfa, and 2 ounces of cult grower. And that diet is 100% balanced for a young growing horse. So mare nutrition in utero, I mean, that's just the foundation. That starts it all. But then correct nutrition, it's really important to know when for your clients to tell you when certain growth problems may have arisen, because that might dictate how we're going to treat them, or how we're going to work with veterinarian to provide nutritional support for them. We can kind of look back in time and see where these issues may have been arising, so that we can avoid it going forward. So that is always important. But just know that it's very important to keep adequate vitamins and minerals. Without them, you will cause problems. Any questions?